All right, guys, welcome back. This is Func Med Nation podcast. I'm Dr. Steve Noseworthy, and I have the immense pleasure of talking to Sachin Patel today. He is a chiropractor up in Ontario, Canada, but he is known, I would imagine at this point, you're known all over the world for some of the work that you've done. And we'll probably get to that. And I see that, the smile come up. It's, I think sometimes amazing when you do innovative and creative things, how it attracts the interest of people, not just in Canada, certainly down here in the States, you're pretty well known for the work that you've done. And I believe, have you actually gone and taught or lectured or done some of your stuff over in the European community?
Yeah, well, it's funny, the reason I have a big smile on my face when you said that is because I had a lady from Sweden come in yesterday named Camilla, and she has been following our work for quite some time and saw that I was going to be speaking at an event on Saturday and flew in from Sweden to specifically come to the event.
Yeah.
And so that kind of blew me away, just knowing the impact that I'm sure your work, my work has all across the world. Sometimes we get stuck in measuring our impact in terms of the number of people that come into our practice or the number of people that, do business with us or, come and seek, our specific care.
Sure.
But the impact is so much broader and wider and sometimes even greater.
Yeah.
It's one thing to change somebody's lab results, it's another thing to change their life. And if we can do it without having any business interactions, then so be it, right? Yeah. It's really cool to know that, hey, for every person that I'm helping in the office, there could be 100 or 1,000 or even tens of thousands that are being impacted positively that we may never hear those stories. They may not be able to fly in and come and hear you speak and share that with you. So yeah, it's pretty cool.
I'm going to ask you a question that I hadn't planned, but it just popped into my mind as you were talking about, having people all over the world follow your work and sometimes take the initiative to come see you, like this lady. It's a pretty heady elixir to be in a position where you're like the guy, right? And people all over the world are messaging you or attending, flying in, spending money, taking time. How do you, because you seem to be a very grounded person, at least from my observation. How do you insulate yourself against the ego boost that comes from that kind of stuff?
Well, great. I think that's a super great question. Humility is something that I try very hard at practicing. So it's actually what I believe is one of the greatest superpowers of people who want to be in a leadership role, right? Sometimes that leadership role is thrust upon us, right? It's not like we're raising our hands and saying, hey, I want to lead this. But, if we have that foresight and that courage to put ourselves out there and people want to come along for the ride and walk this path together is the way I view it, then, the more the merrier.
Yeah.
So I actually follow this ancient Hindu scripture or song or poem, and it's called the Hanuman Chalisa. And so Hanuman, you may recognize if you've been to any Hindu temples or seen any Hindu festivities, there's usually a monkey god. And so he's half man, half monkey. And so he represents us humans really well because we have these monkey minds and these very capable bodies. And one of his superpowers is he can be as big as a mountain when he needs to be, or he can be as small as a mosquito when he needs to be. And when he's a mosquito, he's humble, right? And so that humility in reading the scripture and in trying to embody some of the characteristics of Hanuman, I actually get to practice every single day, right? Because it's easy for things to go to your head. I like for things to go to my heart, and that's where I try to process them. And so for me, it's whenever I hear stories like that, I'm like, who, me? So it's still hard to believe and it's still hard to imagine.
Yeah.
But it's great to be able to have a positive impact on people for sure.
Yeah. And I'll tell you a similar story. I have a client-facing podcast that I launched just over a year ago, and I had a lady reach out to me probably about a month and a half ago, and she went to my website, used a form to contact me, and I have no staff, right? I do everything on my own. I have, kind of like a micro practice. I call it more of a boutique practice than anything else. And so I answered her. I texted her back right away just to establish contact. And I said, hey, so-and-so, this is Dr. Noseworthy, blah, blah, blah. And she texted back and she's like, this is actually Dr. Noseworthy. And then she said, excuse me while I have a little bit of a fangirl moment. And it made me laugh out loud, right? Because, like you, and I think for myself, I've gone through transitions. I've been teaching in the functional medicine seminar sphere for about 15, 16 years. And to be fully transparent, yeah, it went to my head for a while, especially when you get people raising their hands. Like, I'm from Australia and I came to see you specifically. I could have gone seen anyone. And yeah, that got to my head for a while. And then you start to realize that's probably not a very healthy place to be, particularly when I think back about why I got involved in natural medicine. My initiation as a chiropractor is because I wanted to help people the way a chiropractor helped me. And I think many people who get into the natural healing arts of any type of discipline kind of have that same initial motivation. But unfortunately, a lot of times it tends to change over time. And I'm hoping at some point in this conversation, we can talk about clinical models, we can talk about business models as you see them. But I'm very interested in how you've taken your heart to serve and embedded that into, the passion projects that and I'm sure you're doing a lot more than I'm aware of, but things like the perfect practice model and the coaching program and the whole concept of, the Living Proof Institute and the work that you're doing there. So before we jump the gun, because I'm like throwing a whole bunch of stuff out there, let's backtrack and let's talk about your origin story. I know you started as a DC in Cincinnati first, then you moved back to Canada. Where and when and how did you get exposed to functional medicine? And what was it about that spoke to you that said, I need to do this?
I love this story. I actually was telling it last night at dinner to Camilla. And so one of the things that I was doing is sports medicine. I was working in an ART-based practice. For those of you that don't know, it's active release technique. And it's essentially a way to help people with chronic or, acute soft tissue injuries heal faster, better, and even better than before they had the injury itself. So we were getting great results with that. And I was working for a lady at the time, wonderful practitioner, and who was very, very driven and specialized in active release technique. And it was her myopic focus. And she was great at it. And she was an instructor, and people would come from all over the world to come and see her. And I was, doing an externship, and she hired me right out of school. So super grateful for that. And then there was an opportunity for her to be on the news, and she turned down the opportunity. And I came to learn because she had frozen on live television before. Wow. And so she passed the baton on to me and said, "Hey, Patel, you do it." I said, "Okay." I'm 2 years out of school and, getting great results and not afraid of hard work. So, really putting my message and attending all kinds of races and events and all kinds of stuff. So, I built up a good name for myself, and I'm like, wow, the TV, that's going to help take our message even further.
Sure.
So they ran the story. They did a little documentary on a lady named Connie who had tennis elbow. And she had seen physiotherapists, she had seen a surgeon and had some procedures done. Nothing seemed to get rid of it. She came to see us, we got rid of it. And so that's what the story was on. And so the story airs, and lo and behold, the phone doesn't stop ringing. And all these people start calling the office. And here I am thinking, okay, great. Like, we're going to get busier. We're going to help more people. We're going to change more lives. Awesome. And it's right up my alley. And it's like, when you get great results, you feel really confident in helping people. Yeah. And it's a good, it fills your heart, right? Of course, you can let it go to your head, but I like to have it fill my heart and know that, hey, I positively impacted this person, just like you were positively impacted. And so now we go from seeing elite athletes, marathon runners one day, and then as these patients start trickling in for their appointments, these new ones, we have walkers, we have canes, we have wheelchairs, we have all kinds of other stuff. All kinds of different patients with all kinds of different stuff going on that was definitely not sports injury related. I mean, the idea of them playing tennis or running a marathon was not even in their reality. Right. So we started seeing people who were diagnosed with fibromyalgia, with chronic fatigue, with rheumatoid arthritis. One guy had chronic headaches. For 10 years, he took 16 Tylenol per day. Ooh, nice. We did the math, and it was thousands upon thousands of Tylenol. He was 50. He looked like he was 80, right? So if you ever want to know what Tylenol does to you, it accelerates the aging process. All of his hair was completely white because his glutathione is now, in hindsight, was completely depleted. And so like, these are the type of people that we went from seeing, right? So we went from seeing elite athletes to elite non-athletes, right? The exact opposite. And so I start, working up some of these cases, and I'm like, man, like, I'm in over my head here. I don't know what to do with these people. I can't rub these problems away. I can't stretch them away. I can't active release them away. Right. And, some of them were in so much pain, you couldn't even lay your hands on them. And while chiropractic would have been greatly beneficial, philosophically, they needed more, right? Yeah. They needed more than what I could offer. Sure. And what's gutting, as maybe you've experienced this in your practice at times, is when you can't help someone. So that's gutting. Yeah. But what's even more gutting is when you don't know where to send them, because now you know that there's something that can be done for this person. There's always something that can be done, but I don't have the network or the knowledge of where this person needs to go. So I had to start turning down all these patients and saying, listen, I'm sorry, I don't know where to send you. I don't know how to help you. And you've tried everything. So they've seen every specialist, tried every drug. My wife's a pharmacist. So I'm calling her and saying, hey, like, what can we do for these people? And she's like, well, according to the algorithms, they've tried everything, right? And so around the same time, I started getting emails from Dr. Ron Grisanti.
Oh, yeah.
And
yeah.
I don't know how he got my email address. I don't remember registering for it. Right. He must have bought my email from a list or something. And I'm so grateful. However that inbox, however he was able to access my inbox, because what he would share is case studies. So he would share evidence of people reversing their psoriasis, people, getting rid of their diabetes, people getting rid of chronic fatigue. And I'm like, man, this is like really cool. And these are all the people that I can't help and nobody's able to help. So I started following the case studies, and then he offered a training program. And I was, I think, one of the first 10 students that signed up for it. And since then I was hooked. And what I realized within the first few months of learning the materials is that I had health issues that I was not taking ownership over or not seeking answers for, because I just thought that was normal for me. Yeah. So I grew up having, what I would now describe as digestive issues. But when you only have one life that you recall and one digestive system, you just think it's this way for everybody.
Yeah, it's normal. That's right.
I grew up with persistent acne on my back. I grew up with feeling stiff and achy and tired every morning. Turns out I had a gluten and dairy sensitivity. So I would cut out dairy, cut out gluten. The acne disappeared. My joint aches went away. Went from being a late morning person to being an early morning person. I mean, it completely changed my life. So I started implementing that into our sports patients, and we started seeing, they started recovering faster. They started running faster. They started seeing results in other areas of their life that they would have never come to see me for. Yeah. Right. So when somebody comes in with a high calf strain, right, that's all they expect you to work on. But, sure. But when I started giving them the intake form from a functional medicine lens, I could see that they had heartburn, they had headaches, they had, blood sugar dysregulation, right? They were approaching burnout, but they would never think to bring that to my attention if I'm, pigeonholed as a sports practitioner. So I realized that we were sitting on a proverbial gold mine, if you will, of people that we could help, right? And I remember Tony Robbins saying this. He said, find an underserviced market and over deliver. And so definitely people with chronic illness are underserviced. And for them, it's very easy to over deliver, because if you just listen to them, you're over delivering, because nobody's ever listened to them. Yeah. If you think outside the box in terms of lab testing, you're over delivering, right? If you spend time explaining what the results mean, you're over delivering. Right. If you respond to their emails, you're over delivering. So it's so easy to over deliver to these people who have just been kind of swept under the rug or have just been passed around like a hot potato. Yeah. And I'm like, man, this is such a great opportunity to be of service. And, looking back, to be honest, my hands were starting to be achy and painful. And I'm like, man, I'm only like 2-3 years into practice, and I'm working on, football players and marathon runners. And I haven't figured out the way to do ART where it doesn't eventually hurt your hands, right? Or something extremely manual on elite athletes where you could use tools, and then my training was with manual therapies. And so my mom said something to me. She's like, you really have to learn how to use your head more than your hands, because then you can do what you love forever.
You can always trust your mother, right?
Yeah, somehow she's always right. So I was like, that really stuck with me. And I started realizing, well, hey, functional medicine is really a way for me to serve people with my heart and with my head, and not willing to do, I'm willing to do the hard work with my hands if necessary, but I realized that, man, I could really make a positive impact on people. And then as I was leaving that practice, because it wasn't the right fit for me anymore to move forward there, because I really wanted to pursue functional medicine, I was handed a CD. And it was from Dr. Rick Yost. And I bless his heart to this day for handing me that CD. And he said, hey, I heard you're really into nutrition and wellness. I think you'll like this CD. And you'll get a kick out of this. It was James Chestnut's CD.
Yeah.
So I listened to it. I've probably listened to it 1,000 times over the last 10 years. So it's still the only disc that I have in my car. And I refuse to buy a car that doesn't have a CD player because I want to keep being able to play that CD.
Yeah.
And I know there's ways I could burn it. So, but that CD became my daily listen, became my Bible, and it impregnated in me the philosophy of not only chiropractic, but lifestyle medicine, and how simple it can actually be to help people heal when we view the journey towards health like rolling a boulder down a hill instead of rolling a boulder up a hill.
Yeah.
And that's how most people's health journeys are. They're very difficult. They're very expensive. They're very challenging. We're manipulating the body instead of collaborating with it and becoming an ally of its innate intelligence. And when we tap into that innate intelligence through the lens of not just healthy movement, but healthy lighting, healthy breathing, a healthy connection with nature, healthy sleep patterns, right? Healthy oral hygiene, healthy digestive system function, healthy mindset. Once you put all of those facets of the diamond together and start polishing them on a daily basis,
right,
you end up with results. You end up creating a life that people had never even imagined, because we're kind of like, we're all diamonds in the rough, right? When we're born, in a way. So some of us are going to have inclusions. Some of us are going to have extreme clarity, for example, depending on, our past lives and how much processing our souls have done. And so what ends up happening is life is about polishing that diamond, right? And so many people will only polish 2 to 3 facets of that diamond, but think of a diamond that has all 50 facets polished. Think about how brilliant it can be. So that's the philosophy that we apply, is like, hey, you're this brilliant diamond, right, in the rough. Now we just got to smooth out all the edges,
right,
and not just focused on one, right? Not just focus on how you move, not just focus on what you eat, but if we focus on all the things that you do on a daily basis and help you do those things 10% better. If you do 10 things 10% better, that's better than doing one thing 100% better and not changing 9 other things.
Yeah.
Right.
I'm loving this conversation, and I'm thinking that I might want to push this out to my client side podcast as well, just because you're talking my language. In fact, on the other side, on that client facing podcast right now, I'm going through a series, my paradigm, I call it autonomous health, which is taking responsibility for your health and being relatively independent of conventional medicine. Obviously it has its value, it has its place, but it doesn't have answers for the lifestyle related diseases that most people are going to experience. So I just love the analogies that you have, and my shtick right now is to try to help people as much with the diet and lifestyle modifications as possible. And so this kind of brings me around to a question of, and it's kind of like a 30,000 foot view question. Because there is no central governing body that defines what functional medicine is, you and I can do radically different things and still call it functional medicine. So I'm wondering, how would you define, if you were responsible for defining functional medicine for our community, how would you do that? Maybe it's an unfair question, but you're pretty light on your feet when it comes to thinking and speaking. So what would you say functional medicine is?
Yeah. So there's actually 3 different categories that I like to bucket what people do in. So I would say functional medicine is personalized healthcare, where you're partnering with the patient or the client, and the goal is not to be preventive, but to be proactive. And so, I'm not big on prevention, because what we think about, we give energy to, and what we give energy to, we are essentially co-creating. So this model of, oh, I'm going to eat a cancer prevention diet. Well, what about a heart disease prevention diet? What about a diabetes prevention? How many different diets are you going to eat?
Yeah.
Right?
What are you leaving out? Yeah.
And, so a simple analogy there is, like, when you want to go somewhere, you don't put all the places you don't want to go in your GPS. to hope you end up where you wanted to go. You put exactly where you want to go. So it's like a proactive model towards health, because we believe that if you live the first 50, 60 years of your life in a non-healthy state, right, you've never really reached your full potential in life. And you may never, because you were on this downward health trajectory for many, many years. But if you had a proactive health strategy that started from the moment you were born, for example, or even in your early 20s, imagine how different your life would, amortize over many decades. Think about how different that would be. So we think about it as being personalized, we think about it as being a partnership, and we think about it as being proactive. And functional medicine, I believe, there's like 3 layers to it as well. So the first functional medicine version that I did was, I'm going to do these labs that nobody's done on you before, and I'm going to treat the labs.
Yeah.
Okay. And so you do that, right? And then then functional medicine 2.0 is, hey, like, we're treating these labs and your numbers are better, but you're not getting better. What's going on? You're still tired. You're still achy. Yes. You're still this, you're still that, but your labs are better, right? So then we incorporate a little bit of supplementation, a little bit of lifestyle, maybe nutrition starts to change, right? That's 2.0. And then 3.0 is really where we go, much deeper with the patient. So we create a customized lifestyle design for them using genomics. So we use a genomic test that helps us identify, hey, this is you, and these are the things that are going to serve you best. So let's say you have a car. You'd want to know if that car is an SUV. You'd want to know if it's a sports car. You'd want to know if it's a truck, because the utility of it is going to be very different. It's going to thrive. Each of those cars is going to thrive under different conditions.
Right.
So we want to know what that person is, so that we can lay out a long-term proactive health strategy and map out what their day-to-day lifestyle regimen looks like. So we call that a lifestyle design. And so now we're looking forward, right? And most health, even when we order lab testing, is looking in the rear view mirror, right? And there's a reason your rear view mirror is so small and your windshield is so big, right? Because we want a bigger view looking forward, and we want to create aspirational health outcomes, knowing, whether we're an SUV, a truck, or a sports car, and how we're genetically and genomically programmed, and then create an environment that is optimal for our genomics. So an SUV is going to do great for off-roading, not so great on the track, right? So now we know what under what conditions to place that vehicle in, so it performs optimally. And then what we do is we pair people with what we believe are powerful tools like wearables, so that there's a short feedback loop in order for them to know and for us to know if what we're doing is working. So we like to give all of our clients an Oura Ring, because it helps track sleep metrics, helps them track their HRV. And HRV is a great metric to measure the tone of their nervous system and how resilient they are. And so it's a great way to know if we're improving their health without having to do invasive testing or procedures.
Yeah.
And now we have a short feedback loop. So daily they know they're getting better. So this is like helping people create health in real time, having a long-term vision and strategy, and then combining lifestyle and environment with their genomic profile to create the optimal design for them. So that's kind of functional medicine 3.0. Yeah. And we might even call that precision wellness. So it's not just wellness, but it's precise to that individual. And it's individualized for that person based on, how their unique composition is.
I love that whole description, because it mirrors my own evolution and how I look at and see functional medicine. My first exposure was Datis Karazian blood chemistry analysis. Mm-hmm. And at the time, I was practicing in Florida. I was part of a multidisciplinary clinic. Half my day was chiropractic, and I was doing, because of my neuro background, I was doing brain-based spinal rehab mostly. And the other half of my day, I was the clinical director. So it was my responsibility to get the medical doctors, the chiropractors, the nutritionists, everyone kind of working in the same model, which back in the 90s and early 2000s wasn't all that easy. I would imagine it's easier now, but I remember coming home from that first seminar with my eyes, I started to see a part of our world that I didn't even know existed. Mm-hmm. And I've had this similar conversation with everyone that I've interviewed for the podcast so far. It's like, you don't know what you don't know. And then when you get exposed to that, you get some some granularity and clarity on what that looks like, but there's so much more to learn. There's always, the learning curve never stops. And I remember driving home, Rolodexing patients that I had failed with in a brain-based chiropractic model, and realizing all of these people have major metabolic issues.
Mm-hmm.
And so there's only so much, say, manual therapies can accomplish, like you were talking about with the ART. There's only so much you can accomplish with that when the metabolic state of the tissue is compromised.
Right.
And so I too kind of adopted in the beginning a functional medicine model of run labs, prescribe supplements, and then, you know, your job is kind of done. And that works for a lot of people until you meet the person who's more metabolically compromised. And a lot of that is rooted in their diet and their lifestyle choices. And so for me, you know, hearing you lay out Func Med 1, 2.0, et cetera, it perfectly matches the way that I have developed over the last 15 years as well. Although I would say you put it a lot more eloquently than I would. I have to ask, like, all these analogies, like the rear view mirror is so small and the windshield is so big for a reason. Do you come up with these yourself, or do you know, have you heard other people use them, or is it a combination of things?
Yeah, I would say it's a combination of things. You know, coming up with analogies is a gift I believe I got from my grandfather, if I had to attribute it to anyone.
Sure.
So they come naturally to me. And so I try to explain things in terms that people can understand, because I feel like it just makes for more effective communication. And when people can see it a certain way, they can't unsee it.
Yes.
Right. And so I believe that, you know, having, you know, some analogies at our disposal is a great way for us to articulate our message, and for a paradigm shift to occur for people. And a lot of times analogies, there's no counter, right? Like, there's, what do you say to that? It makes sense, and there's a reason things are that way.
Yep.
And so be it. And if I may add, I would say that there's a 4.0 version of functional medicine that's kind of making its way to the surface, and the sooner the better. And that's in this understanding that, you know, right now medicine, and I would argue even functional medicine, kind of looks at the body from a hardware perspective. So we're looking at it from, this is something I can measure, this is something I can scan, this is something that I can calculate, and so on and so forth. I can put numbers to it. But what we have to remember, just like a computer is hardware and software.
Yep.
And so the software is our experiences, our emotions, our programming, our paradigm, right? So we're also, as practitioners, butting up against, you know, what's going on in the brain, what's going on in the mind, what traumas these people have, you know, what challenges they're facing, their stress levels, right? Yes. Stress has a hardware effect on the hardware, but it's actually the software and the perception of the situation that's creating the response in the body.
Right.
So emotional trauma, we're finding, is something that is often overlooked and is the impetus to many people's health challenges. Yes. from a software standpoint. And what's really neat about software is that this is what separates us, right? Our neocortex is like the crown jewel of the cosmos. It separates us from all other life on the planet. And when we're under stress, right, we're sending more blood to our brainstem and our limbic brain versus sending it to our neocortex. And so people cannot necessarily function at their best until we kind of uncouple and unwind that stress response, not just through supplementation, which makes them tolerate the stress better or helps them adapt to the stress better, but really going in and plucking out the code of software that's not serving them anymore, because that's going to tweak their nervous system and put them in this chronically sympathetic dominant state.
Right.
And guess what? Even if I give somebody the right supplements are utilized differently in a body that's in a sympathetic state versus in a body that's in a parasympathetic state, right? If somebody has chronic stress and I give them magnesium, well, that magnesium is going to get burnt up in the process of breaking down adrenaline and noradrenaline, right? So it's going to have a different function. But if I give that same magnesium to somebody who is in a parasympathetic state, in a relaxed state, and is in a state where they heal and repair and regenerate, well, guess what? That magnesium is going to be used to dilate blood vessels. It's going to be used to reduce muscle cramping. It's going to be used to help metabolize glucose, right? So there's that we need to take into consideration, is what, you know, if we're putting this fuel into the body, right, what's happening to it is going to be different depending on the nervous system state of that person. And the nervous system state of that person is going to come from their values, beliefs, and past experiences, And those are challenges that we need to perhaps overcome with some people to really get them feeling their absolute best.
Yeah, for sure. And, in the functional neurology world, we call that whole situation mesolimbic plasticity, right? Because that, especially early childhood trauma, and it, in my experience, it doesn't necessarily have to be physical or sexual abuse. It doesn't have to necessarily be direct mental abuse through being accosted and assaulted verbally and downgraded all the time. It can simply be growing up in what I call a high performance, high expectation family.
Yep.
I've seen many people with complex chronic illnesses, particularly presenting with things like systemic inflammation, anxiety, insomnia, some degree of OCD. And, you dig into their history and you realize, they were never abused in the sense that we think of that, but they grew up in a family where behavior had to be perfect all the time, straight A's, best student in this club, in that club. And so the child grows up into a young adult with all of these external expectations that they then internalize, and it absolutely changes their physiology. And I totally agree with you. And again, just trying to relate what you're saying to my own evolution as a practitioner, you can't expect, and I think this is an unfortunate place where we are, where functional medicine is as a whole. And I think you're on the forefront of the change, because I do think that the average functional medicine practitioner, or I should say the practitioner who calls themselves a functional medicine practitioner, is working at the level of, let me use labs or some kind of diagnostic and prescribe supplements on that. And maybe they dabble a little bit in diet, and maybe they talk to their patients about, you got to sleep better, maybe you should start to exercise, but there's not that precision that you refer to, where you look at that person and you dive deep into all the different domains that go into personalized recommendations. And so I agree with you. I think there's a change coming. How quickly that paradigm is going to be adopted, I don't know. It's taken me a while to get there, and I've been doing this for a while. So I'm grateful for people like you and others who see things that way. I know Jeff Bland, who started, coined the phrase functional medicine. Now, I don't think he uses that phrase all that much anymore, but he's now doing personalized lifestyle medicine. Yep. Which I think is a similar connotation to what you're talking about. Is it true? I heard a rumor. I don't know if it's a rumor. Did you give up your chiropractic license a few years ago in Canada to, well, I don't want to put anything in your mouth. I mean, true or not true? And if so, what was the rationale for that? What did it allow you to do that you couldn't do by still having a license?
Yeah, I think that's a wonderful question. So one of the things I gifted myself when I turned 40 is I retired my license. And it was a multifaceted, but the main reason I did was because I did not have that leash anymore, and I could do and say whatever was necessary to get my message out there. So at the time, this is about 5 years ago, or I'm sorry, 5 years. I'm turning 45 here in a couple of weeks. Hard to imagine. So one of the things I realized is that a lot of practitioners don't speak their truth because their license hangs in the balance. And for me at the time, and still now, most of my income, majority of my income, all of my income really comes from coaching practitioners. And so I didn't have a need for my chiropractic license. Right. And if anything, it was just, holding me back from really speaking my truth and speaking up for, many, many people. Like the things that people think and want to say, they can't say because, their livelihood depends on them being, licensed, and mine didn't. And so that, was a gift to myself when I was in my teens and in my 20s. I always thought I'd retire by 40. That always became my goal. So I'm like, oh, this is like a perfect time for me to do exactly that. Yeah. And so that's what I did. And since then, I just really leaned into, speaking my truth and speaking my voice. I've since then become a functional medicine coach through FDN. So it still enables me to work with clients should I need to, and should I take on certain clients. So I still have that capacity and capability, but the chiropractic license, unfortunately, in Ontario and across Canada, doesn't really recognize functional medicine. So it's like this gray area as well, where they're like, hey, as long as you don't call it chiropractic, then we're okay with it. But then I'm like, well, why would anyone want a chiropractic license to practice functional medicine? It just doesn't make sense. So the rules and regulations here in Canada are a little bit different, a lot different. Scope of practice is very different for chiropractors.
Very different.
And in fact, an FDN or a health coach actually has a better scope of practice to deliver functional medicine and wellness services than a lot of chiropractors do in Ontario. And the other thing too is that when you're licensed in a certain province or in a certain state, it actually limits your capabilities of serving people across borders. So being able to, having a kind of a global brand, if you will, it didn't make sense for me to have such a restrictive license. So then I stepped more into the coaching side of things, where I could still order lab testing, still have all the knowledge that I've accumulated and will continue to accumulate, but then I can actually serve people in a global capacity without having to worry about my license and things like that.
So if you don't have a license as a healthcare practitioner, how do you order diagnostics for people that you're working with?
Yeah, so if you become an FDN, they have something called the medical director program.
Okay.
And the medical director program, through that portal, you're able to order lab testing, and they have a whole system set up so that the people who are trained in that system are able to order the laboratory testing, and it's a proxy license that's being used. So yeah, it's a really neat kind of, I don't call it a loophole, but it's a great way of being able to order lab testing and do it totally legitimately, like it's totally a vetted process, and be able to help people.
Which group did you do your FDN through? Was that Andrea Nakayama's program or someone else?
No, so FDN is a specific program, and that's run by Reed Davis.
Okay, gotcha. Very cool. So all of the things that you're talking about in terms of I'm starting to understand the model. Like I'm absolutely fascinated by the different clinical and business models that people in the functional medicine world use. And as you know, it's all over the place, right? You have clinical models that are as simple as nutrient replacement and as complicated as high-level precision work like you're talking about, and pretty much every step in between. On a business model side, you have guys like me that are a one-man show and a mobile show at that, right? I have a virtual practice and I travel all over North America and serve people. And then you have the brick and mortar. And then you have people who have blended versions where they might see people in an office a couple of days a week, and then they've added virtual consults. And you also have fee for service, and you have packages, and you have programs. And it seems to me that you've kind of circumvented a lot of those different things with your own model, which I think is fantastic. Talk to me. I think I have a sense of what your clinical model is. Talk to me about the business model. And is this the kind of stuff that you teach doctors in your coaching program? And just so I'm clear, is that your perfect practice program, or was that like 1.0 and now you're doing something different? And by the way, I read your book when you first came out with The Perfect Practice.
Oh, awesome. Thank you.
You're welcome.
So over the years, what's happened for us is we've kind of evolved our practice and simplified it. So a phrase that I live by is simplify, then amplify. And functional medicine can get really complicated really quickly. And there's definitely a time and place for that. There's definitely opportunities to help people who have very complex health conditions, like, people with mold and Lyme and parasites and all that good stuff, or bad stuff rather. There's definitely people that love taking on complex cases. What we recognized a few years ago is that the average person isn't even doing the most basic things.
Right.
And even the clients that were coming to see us and spending thousands of dollars, on tests and supplements and consulting, they'd still go to bed at 2:00 in the morning.
Yeah.
And you're like,
dude,
okay.
I literally just wrote out a framework for my next podcast saying that exact same thing. That's hilarious.
Yeah. So then they're right. They've got persistent stress. Their lighting sucks. They don't go to bed on time, right? They have sleep apnea. Like, they have all these things that you can't test for, right? So what's the test for bad breathing, right, throughout the day? What's the test really for emotional stressors, right? There's no lab test for that. What's the test for bad relationships? What's the test for a lack of purpose? What's the test for a lack of connection with source and with nature?
Sure.
What's the test for not being grounded, right? And getting your feet in electrical system balanced. So because you can't test everything, are you really testing anything, right? Became, one of my mantras in my head. And I really had to unpack that for a while. And what we realized is that, hey, the average person isn't even doing the most basic things. What would happen if we had a program where people just did the most basic things? And what we added was more coaching and accountability and support for them to make those changes. And what we found was that we were getting radically transformational results in a short period of time. So even before people would get their lab results back, this other cohort of people was losing 10, 15, 20 pounds. They were sleeping better already.
Yes.
We just started plugging into what are the innate needs of your body. And if you're not meeting those needs, then how will I ever expect you to get well, even if I give you supplementation?
Right.
So there's, James Chestnut talks about this, right? He uses a plant analogy. When a plant is wilting, the first thing we think of is it needs water,
Yes.
but it might need sunlight,
yes.
right? Or it might be getting too much sunlight, or we might need to replace the soil, or it
Yes.
might need the right temperature, right? There's so many variables that contribute to whether that plant is going to grow or not. And of course, we want to pour water on it if that's what it needs. But if it already has enough water, then we're going to kill it.
Right.
So what does that person need became the question. And if we give them what they need, their body never resists, right? We're not fighting a disease, right? This idea that we're fighting diabetes or we're fighting cancer or we're fighting heart disease. Who are you fighting? Right? It's not like your body has like boxing gloves on and it's resisting the positive changes that you're making. It's like, bring it on, man. Let's go. It's like, I've been waiting for you my whole life to do this. Like, let's do this. Right. And it starts producing radically effective, safe results for people. And so we kind of leaned into that. We said, man, if we can get results and keep it this simple, then we can actually create a program that scales. And not only that, but we don't have to hire, rocket scientists to help people if we create a system, right? So now what ends up happening is that, for me, I had so much specialty knowledge, as I'm sure you do have specialty knowledge. It would be impossible to replace you. It's impossible to replace me. But if we could put a system together that anyone can follow, right, then I can plug in health coaches who have a better scope of practice than a chiropractor might in this type of care.
Yep.
Have a virtual practice where the coaches are managing the clients virtually and they're following the system, which we know we've proven over and over works.
Yeah.
And so then that allowed us to simplify. It allowed us to also scale. And so then what we started doing is we white labeled that program for practitioners. So we said, hey, we've got all the assets. We've got the webinar, we've got the education, we've got the program manual, we've got the product line that goes with it. We've got the lead magnet, right? We've got everything that you need to promote this program to people for our practice. Well, what if we white labeled it? We know it works. A practitioner can jump in and in 12 weeks, they can get this whole system set up in their practice. So now they're setting themselves up for success.
Right.
And so, there's white label supplements. Well, we have a white label functional wellness program. And what we realized through this process in doing this is we were able to, without treating any condition, we were able to help people reverse their diabetes. We were able to help them lower their thyroid medications. We were able to help them lose significant amounts of inflammation, get out of their pain. So it became a panacea for people. And literally, if somebody wants to help people with thyroid dysfunction, they can do this program. If somebody wants to help people with autoimmunity, they can do this program because we made it a program that addresses so many different facets of somebody's life, addresses the things that people are already doing, raises consciousness and awareness around them, partners with their body, and then it produces amazing long-term outcomes for people. And we do this without lab testing and without supplements. So that's the other thing that kind of shocks people is like, how did you do that? And it's because we go back to the basics, back to the fundamentals.
Yeah, and I'm sure you've heard this phrase, like you can't out supplement a bad diet. You can't out supplement a bad lifestyle. Mm-hmm. And all of this talk, and I see things similarly. I've often either in blogs or podcasts or in some of my online educational programs that people can do, I talk about, and it's really a functional medicine version of the Pareto principle, which I'm sure you're aware of, right? 20% of the things that you can change are going to give you 80% of your results. Obviously, it's a paraphrase.
Yep.
I totally believe the other thing. And I've kind of taken that 80-20 principle and applied it in a slightly different way. And part of my message is 80% of the results you're looking for are things that are directly under your control. Mm-hmm. And so, why are you looking for the right medication to fix things that aren't rooted in a mechanism that medication can alter or can change, right? What is 80? Another way to say it, Cleveland Clinic came out with this statement not all that long ago, saying that 80% of chronic disease is lifestyle related. And when you factor in concepts like the exposome, right, the sum total of all variables that either internal or external that tend to change our biochemistry, our genetic expression, or phenotypic expression, it makes total sense that if we were to define functional medicine, somewhere in there we have to make allowance for the fact that diet, lifestyle, and environmental interactivity, how the environment or how your body interfaces with your environment, that's got to be the starting point. And so many of us are guilty, myself included, of de-emphasizing people taking personal responsibility in these domains and then jumping straight into let's run a whole bunch of tests and do all this fancy supplementation. Meanwhile, not dealing with the fact, like you said, that they're staying up till 2:00 in the morning with their full spectrum blue lights on, scrolling through Facebook or binge watching Netflix. And they're wondering, like, why can't I fall asleep until 2:00 in the morning? Well,
yeah, my diet's perfect.
That's right. That's right. Yeah. How many times have we heard that? So that what you just talked about with the white label program, is that the perfect practice model, or is that something different and new that you've created?
So that 12-week program is called an accelerator.
Okay.
So it's for people who are, who don't have a program and want to put one together and have all the tools and assets that they need. We also have a mentorship program, and that's more of a 12-month program. So these are people who have, already established their program or have a business that they've already established, and now they're looking for three things. They're looking to automate their practices or components of their practices, so they're not having to do them manually.
Yes.
And create efficiency. They're looking to delegate certain tasks to the right person, the right experts, the right vendors, if you will, so that they're not having to do things that are not easy, lucrative, and fun for them. And the third thing is to accelerate. So the accelerate part, I think, is really important. So if we think back to, kind of high school physics, right? Acceleration is a function of mass and force. And so if we want to accelerate our practice growth, right, there's a couple of ways we could do it. We could have more force, and more force is more time, more money, more energy, more effort, or we could decrease mass. And we decrease mass by delegation and automation.
Yes.
And so that allows us to...
That makes so much sense.
Yeah.
That makes so much sense.
So again, going back to that simplify, then amplify, right? So if we just simplify things in our practice, we automate them, delegate them to the right people and experts, we can move faster, we can accelerate further. And should we desire to, we can scale it as big as we want.
Right.
Now, not everyone needs to build a 7-figure practice. Not everyone needs to build an 8-figure practice. Not everyone has to have an exit strategy, right? You just have to figure out what it is you want this practice to do for you.
That was, and let me interrupt here because like, that was my next question, because, I've been part of a couple of different Func Med practice management groups, and I'm not going to name names because I think all groups have pros and cons. And what I found with the one group that I'm thinking about, which involved, doing dinner talks at least once a week, radio and print advertising to drive people to your dinner talk, discounted initial consults offered at the dinner talk, and then some kind of a conversion factor into people buying programs, packages using case fees. And I was quite successful at that. And I made a lot of money doing that, but I hated it. I absolutely hated it because I'm an introvert by nature. And being out there all the time, and like even back when I was doing chiropractic, like I have friends who are seeing 100, 120 people a day, and like I got to 25 and I was done. because I was so mentally, emotionally drained just because of my personality and my makeup, that constant interaction with people, I needed more recovery time. I'm not the type of person who can have that high interaction level and come away renewed. I'm the opposite,
Right.
right? And so I burned out on that model, even though from a business standpoint, it was working quite well. So what it sounds like to me is that you've taken the perspective, and if I'm right, I love this, that you look at what the person wants that you're coaching and using, maybe I could call it a loose framework. You take that and try to fit it to the goals, the needs, and the desires of the person that you're coaching. Am I hearing you right on that?
Yeah, absolutely. So there's a framework that we use, and it's called the 5 freedoms. And it's a specific order that they go in as well. So your business should never cost you these 5 freedoms. And in fact, it should create these 5 freedoms for you. So the first one is health, right? If we as practitioners are not the healthiest members of our society, then who can we expect to be? Right. So our business should never cost us our health. The next one is our emotional wellness. Yes. Right. If we bring home all this stress every day, we put this constant pressure on ourselves, we're never enough. I mean, how does that play out and amortize over a lifetime? Right. Not really well. Or we might have a lot of money in the bank account, but if our kids don't look us in the face, or we never see them, or we have constant disagreements with our wife or our staff, like, what kind of existence is that? Right. So we don't want our practice to cost us our emotional freedom as well. You should be free to have whatever kind of day you want. Yes. Right. And if you decide you want to have a bad day, that should be up to you, not up to other external factors. It should not be up to your business if you're going to have a bad day today. Right. It should always be up to you. So that's where emotional freedom comes in. The next one is geographic freedom, right? How can we be geographically free so that I could be doing my job, making an impact, having influence on people anywhere in the world, right? So I get to travel a lot. I don't have to skip a beat. And if I want downtime, I have the freedom to do that because I control my schedule, not my clients. So geographic freedom to me is important. And of course, time freedom. How can we create more time for ourselves? How can we structure our business in such a way that it frees up our time, right? Or our time is revered and valued and cherished, and we spend time doing the things that we love doing. Listen, I love helping people.
Sure.
Right. So some of my time on the weekends is even going to be helping people, right? And coaching people and supporting them and serving them and hosting workshops and stuff like that. I love doing that. So I love spending my time that way. So we should love spending our time doing the things that we enjoy doing. I don't like accounting. So guess what? I delegate that to somebody else, right? There's certain components of my business that you couldn't pay me to do, and I don't want to do them. And so I hire people or outsource that task to somebody else. So I have that time freedom to do the things I love doing. And then number 5 is financial. Financial freedom, unfortunately, won't buy you time, right? May not give you geographic freedom, right? So you might have a lot of money, but you may not have the freedom to travel places and, operate your business from across the world if you wanted to. So there's that. And then certainly money won't hug you at night. So it doesn't always give you emotional freedom.
Sure.
And it's not going to buy you health, right? If money could buy health, no one would be able to afford it. So, we never want our business to cost us any of those 5 freedoms. A lot of times what will happen is people will focus on financial freedom first at the expense of health, at the expense of their emotional wellness, at the expense of time, at the expense of geography. And then they realize that, hey, I have all this money, but I can't buy those things. Yeah. So what have I done? So first is, let's reverse engineer what you want. Right? Let's figure out your love language. Let's figure out what lights you up. Let's figure out like what you want to design your life to look like. And then let's build a business around that. And so what we found is that everyone's definition of success is different, right? Some people's definition of, really, like in Hindu scripture, the definition of success is not wanting anything, right? So if I just eliminate all desires, right, all material desires, then I'm instantly successful because I have no desires, right? But the person who's constantly chasing something who's constantly chasing success sends a message to their subconscious that they're not successful, because they're not successful until they accomplish some sort of external goal. So a lot of the work that we can do to become instant overnight successes, you can become an instant overnight success by eliminating all material desires. And what ends up happening is your energy, your vibration, how you show up in the world completely changes, because now you're not talking to that person because you need to make that sale, right? Because you need to go buy something stupid that you don't need, right? You're talking to that person as a human being whose time and energy and experience is just as valuable as yours, right? And that's where that humility comes in, is that, hey, we're just all walking this path together, right? And if you're the right fit and you can keep up with me, I'm going down this path. I'd love for you to join me.
Right.
And if not, hey, there's a path that you can take that goes this way. When I see people going down that path, I never see them again. And I don't know what happens to them.
Yeah.
So you get to choose.
Yeah. For the average practitioner who goes through your accelerator program and implements this framework where they've, delegated a bunch of different stuff, on average, what do they spend their time doing during the week? Are they doing like new client interviews? Are they just overseeing the work of health coaches? Like what? And I'm sure it's probably different for different people, but think of the prototypical person who's in your program. What's their week look like?
Yeah, I'll use my wife as an example because I have an intimate experience of what her day looks like, and I can definitely speak on her behalf. And I think it's a very kind of desirable situation as well. And everyone's different, right? Depending on what stage of your business you're in, there's 7 energy centers in a business, and the first one is relationship capital. So, if you're just starting out, you really need to lean into relationships, right? So you might be joining the Chamber of Commerce, you might be joining BNI, you might be building relationships on social media, you might be going to coffee with your friend, right? So you have the freedom to decide how you want to do that. The next energy center is marketing and messaging, right? So getting on stages, putting your message on Facebook, doing webinars, right? Education, training, paradigm shifting. That's the next step. And so that might look like a webinar. So my wife does a webinar every other week and on metabolic wellness and health. And she offers a discovery call. So then that fills up her week with discovery calls. We just brought on a new coach that's going to be doing those for her. So because her book's just getting too busy. And so she'll spend time doing discovery calls, reviewing the intake forms before they come in. And then once that person says yes, then we pass them on to a coach who then onboards them. And then the coach works with them on their day-to-day accountability and coaching and does their one-on-one calls with them. So my wife's role is basically to go out there to build relationships, to put the message out there in the world, and then help people identify if they're the right fit or not. And then after that, the next energy center after messaging and marketing is onboarding or sales, right? Is that conversion from somebody who's a prospect into a potential, now a client. And then there's program delivery. So our coaches do the program delivery component. And then there's program over delivery. So we always try to go above and beyond for our clients and over deliver, as I mentioned earlier. And then the last the last energy center is going to be, the last 2 are going to be raving fans and referrals. So how do we build an army of people who just really love what we do? So my wife will do some of that. I'll do some of that, right? Just to get people amped up and be supportive of our community and others on the journey. And then some people are going to become, referral sources for you, right? So we're, again, building and developing those relationships. So my wife's day looks like she gets up in the morning, prepares a nice meal for my son and I. I usually don't eat breakfast, so she'll make my coffee in the morning. And then I get to drop my son off. She has her morning time to do yoga, meditation, mindfulness, get grounded. She'll start her day around 10 with consultations. And then she's usually done around 3.
Yes.
So that's kind of what her day looks like. And so we have lots of freedom, lots of time that we can spend with my son. My wife also does coaching in our coaching program. So she takes clients through the metabolic process, but also trains them and educates them on that. So she'll do some training in group settings a couple times a week as well. So some of it's going to be one-on-one, and some of it's going to be group, and some of it's going to be in a webinar format. So it's probably, that's how she spends most of her time.
Sure. So is it that, do you and your wife maintain your own separate practice and then you've got the coaching on the side, or are you just strictly in the coaching side of things? You personally?
Yeah. So for me personally, I'm focused, I would say 90%. Or maybe let's say 80-20 using the Pareto principle. Yep. My focus is primarily going to be on coaching practitioners.
Gotcha.
My wife is going to be more on the side of client facing for, people who want to be, clients of a metabolic wellness program or a health journey.
Yeah.
And then the coach is the one, Alice in our case, is the one that takes people through their programs.
So on the
she's the
client
one
side,
that's doing.
I'm sorry to interrupt. Go ahead.
No, so she's the one that takes the clients through the program and process.
I got you. So on the client side, is it strictly one-on-one coaching, or is there an element of community? I had a great conversation with James Maskell a couple of weeks ago, and I know you know James. And he was talking about his next evolution and what he sees as going. Now he's got a whole different thing because he's trying to transform the medical community using concepts that we've embraced in functional medicine for a very long time, and he's very focused on like group coaching and building communities. So do you employ that tactic as well?
Yeah, absolutely. So we actually have a 4-part framework. So we have self-study, right? So this is where there's recordings, there's trainings, you can watch those and prepare. Next up from that is we have community, right? So this is in a group setting where we'll do trainings and teachings. And so, as I mentioned, my wife does those as well. And so you might have one person hosting the call and 50 people on the call, right? Because what you're training and teaching them is the same thing, right? And they all have similar questions, and then you do some Q&A and all their questions are answered. And then you're able to share the recording so then they can watch it whenever they want to as well, or those people that miss it can watch it. Understood. Next we have daily coaching. So daily coaching is where they check in. We have an app and they check in on a daily basis. And we also collect their Oura Ring data. So that information gets pulled into our system. And so the coach is just monitoring, making sure that, they're not seeing any abnormal flags or trends, or if somebody's not sleeping well for 3 days, we just want to make sure that, we're able to touch base with them and check in on them and make sure everything's okay. Yeah. And they're also checking in with their weight. They're checking in with their blood pressure if necessary. And they're also checking in with their blood glucose, depending on the program that they're in. And so we get all this data that comes in that's streamed into us daily, and that's totally optional. We don't expect everyone to do that, but some people like that accountability and it's available to them. And then we also offer one-on-one. So there's 4 layers to what we offer them: the one-on-one, the personal accountability through the app, the group setting, and then the community online, the Facebook community that we have, and then the self-study components. Right.
I think it's a beautiful framework. I have a question, which is really more practical and more my own interest. But when you were looking for the wearable that you chose to use in the program, what did you consider other than the Oura Ring? And what advantage do you think Oura has over other systems, whether it's just like an Apple smartwatch or Fitbit or something else?
Yeah, great question. So Oura has served us well. I like the form factor because it's a ring, and most people already wear a ring or are open to wearing one. And it collects HRV, which I think is a very important metric for us to be able to measure. And it's also going to help them track sleep. So sleep is a big pillar in our process. So we wanted to have a really good sleep tracking device. The other reason we chose it is because it also has an airplane mode, so I can turn off the signaling. So people who might be electrosensitive or electromagnetic sensitive, we're not worried about that with those people as well. The ring you can wear just at night if you want, so there's that capability as well. To answer your question about what else we looked at, I would encourage people to look at the Garmin Vivo Smart 5. That's one that I've worn for quite some time. That also has an airplane mode, and it collects great data. And I believe that the real-time data that it offers is actually even better than the Oura. So the Oura, you have to kind of pair with your phone to get any feedback from it. Yep. But the Vivo Smart 5 has a little mini screen on it, so you don't have to check in with your phone to see what's happening. And if you want to look at your resting heart rate or your respiratory rate, then you can see all of that in real time versus having to tune into the app.
Right. Perfect. I'm watching my time. I feel like I could talk to you for another hour or two at least. And maybe if you're open to it, I'd love to have you back on just to explore some other different thoughts, whether it's clinical or business related or just self-care. That's, one of the things that I'm trying to build with this particular podcast and community is to recognize that, hey, it's not just about being a great clinician. There is a business side to things. And listen, you're a human. And in most cases, you're not living by yourself and you have other people that rely on you. So how do you take care of yourself well so that you can take care of everybody else and interact and connect with family, friends, loved ones, your community in meaningful ways? So having said that, what advice would you give to 3 different types of practitioners? And I'll just list them and we can deal with them one after another. The first one is a doctor or a practitioner of any credentialing who's just coming out of practice or coming out of school into practice and wants to do functional medicine in some way, shape, or form. The second one would be someone who is in practice in some capacity and wants to add functional medicine to what they're doing. And the third one is someone who's doing functional medicine but is struggling to make it work. So let's start with the first one. Advice for the brand new practitioner who wants to get into functional medicine.
Yeah. So the big doozy there is belief, and really believing in yourself and, the impact and the value that you add into people's lives. So the best advice I could offer someone who's starting out is a mistake that I made, which was I positioned myself as the hero in the client's journey. And instead, what I invite people to do is position themselves as the guide or the sage who's going to walk that person through their own journey.
Yeah.
And no one and no system, the kind of a nice one-liner here is there's no system of healthcare that can save people from themselves.
Right.
So we're not going to save them. It's not on us whether they get better or not, right? It's absolutely 100% on them, because we're not injecting stuff into them. We're not cutting out body parts. We're asking them to make strategic lifestyle changes, environmental changes, dietary changes, upgrades, really. And so they've got to be compliant. And so the first 50 patients, even the first 5 patients that you select and work with, you want to make sure you're correctly positioned. Yes. Otherwise, you're going to try to save them, and you could never save someone who actually wants to drown, right? And believe it or not, some people want to drown and they're looking for somebody to come and save them. So choose your clients wisely, because those clients are going to determine your confidence, your certainty, and how much you believe in yourself. And so if you pick the wrong patients, it's going to beat down your own self-worth and self-belief.
Yeah, and that's a hard transition for people to make, especially when you're either new in practice or starting like another, let's call it a business line where you're doing functional medicine. The temptation is to take any client, right? Because you're looking at it more of like a business transactional thing. I can't remember which of the ancient philosophers said this, but it's something like, if someone wants to get well, first ask them if they're willing to give up the things that made them unwell. And again, that's a paraphrase. It might have been Hippocrates or one of the other ancient philosophers. All right, so that's the first one. But what about someone who's been in practice for a while and wants to add functional medicine? And I would say that what you just said applies to anybody at any stage, so you can't say the same thing. You got to give me a different answer.
So somebody who wants to incorporate functional medicine into their practice is first and foremost, you have to realize that it's almost a separate business. So while there is, if you draw a Venn diagram, there's overlap, right? Philosophically, there's a lot of overlap, but how you deliver that program really has to be unique to, perhaps if you're a chiropractor, it has to be, kind of almost like a separate service, I would say.
Right.
Many people will tell you to have separate scheduling days, because switching gears between structural care and consulting care is a lot more challenging, right? And it's just hard to do that sometimes. So make sure your schedule is set up for success as well, and you're able to manage that side of things. Another thing to take into consideration is hiring the right people. So sometimes it'll be a tendency. I just had a client of mine ask me this. He's like, "Oh, I want to work with people across different state lines. Like, what coaching program should I take?" And I'm like, "Dude, why don't you just hire a coach?" Right? Because if you're going to go get a new certification and then you're going to start coaching clients, just adding more work to your plate.
Right.
And to me, that doesn't spell freedom, right? That's like just putting another bar up in your jail cell. And there's many under leveraged coaches that are out there right now that you could hire, and instantly your problem is solved.
Right.
And so the tendency for some people, especially when they're starting out, is they want to be conservative. And I would say if you're going to be conservative with anything, right, be conservative where it actually matters. We don't want to be conservative to the point where we're actually creating limiting beliefs. So sometimes practitioners are reluctant to hire people because they're saying, oh, well, I don't have a business, or I don't have enough business to hire someone. Well, let me ask them this. Let me pose this question. If you could hire someone that could take 160 hours off of your plate every month, right? Do you think if you spent an extra 160 hours doing the things that you're really good at, that you would more than be able to pay for that person and afford that person?
Right.
And if the answer is no, then just shut down your doors, because you'll never be successful. But if the answer is yes, then hiring someone makes so much more sense than you adding all this work onto your plate, right? And as an entrepreneur, as a visionary for your business, you should be able to go out there and spread your message and spread your wings and get people to say yes to what you're offering. And then you put a staff member, a team member in place, a coach who's passionate, who wants to serve, who's eager to serve, who isn't burnt out, right? Who isn't trying to burn the candle at both ends and trying to run 3 different businesses at the same time. And you're going to get way better outcomes that way. And you're going to be happier too, because now you've created an arm of income that doesn't depend on you.
Yeah. What about the final case scenario? Someone is doing functional medicine, but for whatever reason, it's not working for them, whether that means clinically or personally or business wise. And I'm sure that the first question is, well, what do you mean by it's not working for you? But just take that and go wherever you want with it.
Yeah, sure. So I know quite a few people might get stuck there. So they're just feeling unstuck, right? And so one of the underlying themes of my upcoming event is how to unstuck yourself, because you might be, some people are stuck at 0, some people are stuck at 100K, some people are stuck at, and not even an income level. Some people are just stuck in their practices, and they don't know how to, navigate and have a business and have a life at the same time. So my mentor, Joe Polish, gave me a really good exercise. He gives everyone in Genius Network this exercise. It's called HALF versus ELF. So HALF stands for hard, annoying, lame, and frustrating. Easy stands for easy, lucrative, and fun. So I have my clients do this on a quarterly basis, where they write down all the things that they're doing that are hard, annoying, frustrating, lame, like the things that they don't want to do, and then do this and make a list of those things, and then make a list of all the things that they do that are easy, lucrative, and fun, and spend most of their time doing those things, and delegate or hire out for the things that they don't enjoy doing.
Right.
Because, my philosophy in business is you make it up, right? You get to choose what your business offers. There's no, you're not buying a franchise when you start a business. So if there's a service that works well, keep doing it. If there's one that doesn't, then drop it, right? So make it up and, decide how you want to design your business and your offer. Make it simple, because simplicity is sexy. Simplicity scales. Simplicity allows it to be easy for you to hire people. If you've got this complicated, convoluted process going on that only you know how to make function, then guess what? It's impossible to hire people. And then you hire people and you lose them. It's because you have this really convoluted process. So make it simple. Whether you want to sell it as a franchise at some point in the future or not, build it like a franchise. Michael Gerber talks about this in his book called The E-Myth, right? The best business to create is a franchise model, whether you want to sell your business or not, because it's the easiest to hire and train people. And if you decide to scale it, it's easy to scale. Next is make it fun. So how can I make my business more fun, right? If you love speaking, do more speaking. If you love posting on social media, do more of that. If you love networking, go and do more networking, right? What is it that you love doing that lights you up, that you look forward to? I was looking forward to our conversation today, right? So how do I do more of that? But if you're dreading things, then energetically, right, you're going to want to pull your covers over your face in the morning. That's not a good sign. So what are you doing to make your business fun? And part of that is making it up under your terms, making it simple, making it fun, and then make it with love. Right. So that criteria, I feel, works really well for people who are a little bit more established, just asking themselves that question, is this a business? I made this whole thing up. So how can I make it more simple? How can I make it more fun? And how can I do it so that it's something I love doing? Right. And your business is going to take up a lot of your life and time. And, as healthcare practitioners, it's hard for us to separate the two, because we bring what we teach into our homes on a daily basis, and we might be answering emails after hours, but I don't mind doing that, right? I set proper boundaries for myself. I set realistic expectations for people, and I love doing it. So that's what allows me to have longevity in running my business, allows me to stay lit in, and light, it really lights me up to be able to deliver what we do the way we do.
What do you say to the person who's listening to you in this podcast? Because you are like, you're so fluid. You're pulling all these elements of how you see things, your coaching program, the 5 freedoms. And I mean, all of this is just coming very naturally. What do you say to the person who's listening to you that's thinking to themselves, I could never be like him?
You can't.
Oh, good
right?
answer.
Just like I can't be like you.
Yeah.
Right. Like the point isn't to be like each other. The point is to really figure out who we are and then put that out there in the world.
I love it.
So everyone's competitive advantage is that they're a unique human being. Yeah. And there's no one else, as far as we know, maybe in a parallel universe, right? There's another version of them. But as far as we know on this planet, there's no other version of you. And so one of the things that I emphasize to people is that information and experience are 2 different things. So if you're competing with me on information, like I could never know what he knows. Well, all the knowledge is already available online. So that's not true. That's not accurate. And you could know more than I know, right? And most people know more than I know. So information is not what makes us unique. What makes us unique is our experience. And so people are probably going to hear me speak and be like, man, I can never connect to this guy, right? He's unrelatable to me because maybe we don't share the same experiences or even the same values. But if we do share the same experiences and same values, there's going to be an instant bond and connection that you can't build with somebody else, right? So we have to always remember that experience is more valuable than information. And many people will try to out-information somebody else.
Right.
Try to out experience somebody else. And you're not even trying to, it's not even competitive. Hey, these are my experiences. This is what I love doing. These are my values. And guess what? There's thousands of people, more than what you know what to do with, that will resonate with you and who you are. So, put yourself out there into the world, and guess what? Don't try to be like anyone else. Be you.
That's so counter to what I'm seeing in a lot of the functional medicine coaching programs that are out there, which is, hey, I achieved a certain level of success. I did it this way. Do it like me, be like me, say things like me. And I love the fact that you're coming from this perspective of we're all different. We're all unique. We all have value. We all have individual hopes, dreams, aspirations, and goals. And let's help you build something around that. Like I love the approach, Sachin. I think you've done an amazing job. So final question, what does Sachin Patel do in his spare time?
In my spare time, for me, I love spending time in nature. So I back onto a conservancy. So we've got acres and acres of forest behind us. So I love going out there. I love home renovations, believe it or not.
Wow.
And just fixing things. I like working with my hands.
Yeah.
And, I love washing and waxing my car. I know that sounds a little bit weird, but I love things. I love doing things where I can see an instant result.
Yeah.
Right. So for me, I have I like instant gratification. I definitely play the long game in life, but I like to have experiences where I can see immediate results. So like washing my car is like an addictive process.
That's so funny.
For me, because I get to see like a clean car, right? And I get to see, wow, I did that, right? And when I do a home renovation, I'm like, every time I walk by it, I did that, right? So just a reminder of our diversity and capability. And I like to keep my brain pretty plastic and learn new things as well.
So we just spent the summer back in Newfoundland with my dad, and I bought a small piece of land from one of my older cousins back in the old homestead where my dad was born and grown up. My extended family, everyone's got property back there. And so I spent the summer, I would do a handful of consults. I might have a 2 or 3 hour break, or maybe I get done early at 2:00. I would literally come out of my RV, walk across the street with a chainsaw and an axe, and I would spend hours clearing the land. And I don't know if you've ever been to Newfoundland, it's nicknamed the Rock for a reason, because it's nothing but rock and spruce and fir trees. And I loved it. It was one of my favorite summers because I got to work side by side with my 84-year-old dad.
Wow.
I'm cutting down trees and limbing them out and stacking them, and he's cutting up the branches and burning them in this old hollowed out oil can, like big, 4 foot, 5 foot long thing. And I loved it. And I'm like you, like I love to see that instant change, that gratification of that spot used to be full of trees, and now look at the view that we have. To me, that's renewing. That's very restorative. So I hear you on that one. Well, listen, this has been amazing, and I do hope that you can make some time to come back and chat with us again. I will put, if you will provide me links that you want to share with the audience, I'll make sure that they go into the episode description. Other than that, Dr. Sachin Patel, man, thanks. I truly appreciate it. I love this conversation.
Thanks, my man. It was so wonderful, such a great pleasure and such a great honor for us to be able to connect this way and keep doing the amazing things that you're doing, living a life that's fulfilling to you. And thank you for sharing your platform with me today.
Anytime.